The pediatric orthopedic program here at Bristol Myers Squibb Children's Hospital focuses on the entire range of children's orthopedic problems, including complex spinal deformity, pediatric trauma, pediatric sports medicine, and deformities of the limbs. Limb deformity can range anything from a small difference in the lengths of the legs to complex angular deformities or rotational deformities. The most common reason to see a limb length discrepancy is if a child's had a fracture affecting a growth plate of the lower extremities. And the younger they have that fracture, if a growth problem does occur, the bigger the discrepancy will be when they're older. A lot of it is very simple to deal with modulation of growth through the growth plate and simple procedures. If a deformity looks like it's going to be persistent through adult life, surgery is probably going to be the answer. And the technique we use currently is the Taylor spatial frame. We are using a device outside of the body that is connected into the body by a combination of pins and wires. And once this device is connected and the bone is cut, then you select certain parameters, specifically distances from the points that you intend to move. You define the deformity, and you use a computer algorithm to program in the settings of the position of the device. The device can be repositioned slowly over time to draw the limb into its new position, and then it can be held there until enough bony healing takes place that the device can be removed. And typically this can take anywhere from a couple of a month to 4 to 6 months, or even longer when you're doing lengthening. What they'll expect to experience in the hospital is 4 or 5 days in the hospital, okay, where they will have the device applied. There is some pain associated with this afterwards, and usually they require pain medication for a week or two afterwards. The outcomes in children have been found to be excellent. The frames are very well tolerated. To see a kid, come in 6 months after they've had their surgery and walk in and say, "Doc, I really feel good that I am able to get around and my leg's straighter," there's nothing better than that.